Cardiac surgeon warns this drug is damaging the hearts of older adults. I am about to share information that might genuinely surprise you, even shock you. This isn't about some rare illness or obscure medical condition. It's about something potentially present in your very own bathroom cabinet right now, quietly and relentlessly attacking the most crucial organ in your entire body, your heart. My name is Dr. Michael Kent, and for 2 decades, I've dedicated my life to cardiac surgery. During this time, I've witnessed a deeply disturbing pattern. Perfectly healthy individuals, people with vibrant lives and no prior warning, walking into my operating room with hearts that have been severely damaged, and the cause, not a debilitating disease, but rather medications they had placed their complete trust in, believing them to be entirely safe and beneficial. These aren't some exotic new pharmaceuticals or experimental treatments whispered about in clandestine medical circles. On the contrary, I'm referring to the everyday pain reliever you might have taken this morning to soothe a headache, the stomach pill you swallowed with your breakfast to manage a bit of indigestion, or even the cold medicine you grabbed from the pharmacy shelf just last week without a second thought. What I am prepared to reveal today runs entirely counter to almost everything you've been told and have come to believe about these widely available, so-called safe medications. The pharmaceutical industry, with its massive influence, largely prefers that you remain unaware of these hidden risks. And unfortunately, most doctors won't be the ones to tell you, not out of malice, but because they themselves often do not fully recognize the profound and devastating connection between these common drugs and serious heart damage. But I have seen it repeatedly, with my own eyes, in patient after patient, heart after heart. And after years of watching this silent epidemic unfold, I simply refuse to remain silent any longer. By the time you finish watching this presentation, you will possess a clear and crucial understanding of exactly which 5 specific medications are, in many cases, secretly weakening your heart muscle. You will learn precisely why these particular drugs become so dangerously problematic after the age of 60, a critical threshold for cardiovascular health. And most importantly, you will discover actionable steps you can begin taking today to proactively protect your heart and safeguard your well-being. This isn't an attempt to instill fear or spread alarm without basis. It is, quite simply, the life-saving truth that you deserve to know. Please stay with me until the very end, because the knowledge you are about to acquire could quite literally add precious years of healthy life to your future. The silent attack of everyday pain relievers, NSAIDs. Let's begin our discussion with a class of medications found in virtually every single home across America, and indeed around the world. The non-steroidal anti-inflammatory drugs, more commonly known by their abbreviation NSAIDs. You recognize them by familiar brand names like ibuprofen, naproxen, and diclofenac. These are your trusted go-to solutions for a myriad of discomforts. The throbbing headache that disrupts your day, the persistent back pain that makes movement difficult, the stiffness and soreness of arthritis, or just general aches and pains. And there's no denying their effectiveness. They work brilliantly at alleviating pain and reducing inflammation. They offer quick relief, allowing many to function through daily activities. But here is the critical piece of information that almost nobody tells you: the hidden cost of that convenient relief. For individuals over the age of 60, particularly if there's any pre-existing heart condition or even a family history of cardiac issues, continuing to regularly ingest these pills without careful consideration is akin to engaging in a dangerous game of Russian roulette with your most vital organ system. Each pill, seemingly innocuous, could be the chamber that triggers a serious cardiovascular event, silently escalating the risk of heart attack or stroke with every dose. The medical community has, in fact, been aware of this dark secret for decades. As far back as 2005, the U.S. Food and Drug Administration, FDA, recognized the gravity of the situation and demanded clear, prominent warnings about the increased risks of heart attack and stroke be placed directly on the packaging of these medications. Yet, despite these warnings, millions of people continue to pop them daily, almost like ordinary candy, completely unaware of the insidious danger lurking inside each and every tablet. The message simply hasn't gotten through effectively enough. Allow me to share with you the poignant story of Michael, a vibrant 72-year-old patient who found immense joy and solace in working tirelessly in his beautiful garden. Michael suffered from chronic knee arthritis, a condition that caused him considerable pain, so he conscientiously took naproxen almost every single day to manage his discomfort and continue his cherished hobby. One sweltering afternoon, while diligently tending to his beloved rose bushes, he suddenly felt an overwhelming sense of exhaustion. He couldn't catch his breath, feeling a crushing weight on his chest, and, to his alarm, his ankles had visibly swollen to almost twice their normal size. When his worried family rushed him to the emergency room, we made a grim discovery. Michael was experiencing acute heart failure, his heart already working overtime to compensate for age-related changes and mild hypertension, simply couldn't keep up with the increased demands anymore. The devastating trigger for this sudden collapse wasn't a new, previously undiagnosed cardiac condition. It was the continuous, long-term use of that seemingly innocent anti-inflammatory pill he had trusted so completely. How can something so ubiquitous, so commonly used, be so potentially deadly? The mechanism behind this danger is insidious and multifaceted. NSAIDs function by blocking specific enzymes in your body, which is how they effectively reduce inflammation and pain. However, in doing so, they also inadvertently interfere with the production of other vital substances that normally protect your kidneys and maintain the health and flexibility of your blood vessels. This interference leads to two catastrophic effects on your cardiovascular system. Firstly, NSAIDs compel your body to retain an excessive amount of salt and water. Imagine your heart as a powerful pump constantly working to circulate blood throughout your body. If suddenly there is a significantly larger volume of fluid circulating within your vascular pipes, that pump is forced to work at its absolute maximum capacity under immense strain. A young, robust heart might be able to temporarily handle this acute stress. However, a heart that is already contending with the natural stiffness associated with aging, or one that is constantly battling the elevated pressure of hypertension, can become overwhelmed and fail completely, just as it tragically did for Michael. Secondly, and equally dangerously, NSAIDs can cause your blood vessels to constrict and narrow, thereby significantly elevating your blood pressure. Even if you don't have a pre-existing diagnosis of hypertension, regular and prolonged use of these drugs can raise your blood pressure to alarmingly high levels. And if you are already taking medication to control high blood pressure, NSAIDs can incredibly, completely cancel out their beneficial effect, sending your pressure skyrocketing without you even realizing the silent danger unfolding within your body. It is absolutely critical to understand that the level of risk is not uniform. It largely depends on both the dose you take and the duration of your usage. Certain drugs, such as diclofenac and high-dose ibuprofen, typically around 2,400 milligrams daily, are the most strongly associated with severe cardiac problems. While low-dose naproxen appears somewhat safer, it is crucial to remember that the risk is never entirely zero. And here's another shocking revelation that many are unaware of. If you are conscientiously taking a low-dose aspirin regimen to protect your heart, certain NSAIDs like ibuprofen can actually neutralize that protective effect entirely, rendering your aspirin virtually useless. So, what steps should you take if you're concerned? The solution is certainly not to silently suffer through pain or discomfort. The first and most vital step is to have a frank, honest, and comprehensive conversation with your physician. Ask them directly, "Doctor, given my specific medical history and any existing conditions, what is truly the safest pain relief option available for me?" There are often viable and much safer alternatives. Sometimes acetaminophen, often known as paracetamol, can be sufficient for mild to moderate pain. Other times, topical anti-inflammatory creams or gels, which act locally on the affected area without systemic absorption, can be excellent choices. And if an NSAID is deemed absolutely necessary, after careful consideration, the golden rule remains: use the lowest effective dose for the shortest possible duration to minimize potential risks. The bitter irony of stomach protectors, PPIs. Now, we move on to the second type of medication on our list, and this one will undoubtedly surprise many of you because it is widely marketed and perceived as a protector for your stomach. I am referring to proton pump inhibitors, commonly known as PPIs. You'll recognize names like omeprazole, pantoprazole, and lansoprazole. These are not obscure drugs. In fact, they are among the most frequently prescribed medications in the entire world, swallowed daily by millions. Many individuals take them every morning, almost like a ritual, to manage persistent acid reflux or heartburn, or sometimes to shield their stomach lining from the potential irritant effects of other medications, such as the very NSAIDs we just discussed. And here lies the profound and bitter irony: the very medication prescribed with the intention of protecting you from one particular risk, a stomach ulcer perhaps, might actually be unwittingly creating another far more serious danger to your heart through the back door of your physiology. Let me share the sobering story of Helen, a 68-year-old woman who was prescribed omeprazole for chronic debilitating acid reflux. She was explicitly instructed to take it indefinitely, perhaps even for life, to keep her symptoms at bay. Her acid reflux symptoms indeed disappeared completely, bringing immense relief, and she never once questioned the long-term implications of her daily pill. Years later, during a routine annual checkup, her electrocardiogram, ECG, revealed something highly unusual and concerning about her heart's electrical activity. Subsequent blood work quickly revealed the underlying cause. Her magnesium levels had plummeted to a dangerously low point. Magnesium is an absolutely vital mineral, often referred to as the guardian of your heart's rhythm. When its levels are severely depleted, your heart becomes electrically unstable, much like an orchestra attempting to play a complex symphony without a conductor to guide it. This electrical chaos can lead to the emergence of dangerous and potentially life-threatening arrhythmias. The direct cause of Helen's severe magnesium deficiency, her chronic, uninterrupted use of omeprazole. PPIs work by drastically reducing the amount of acid in your stomach. While this alleviates reflux, that stomach acidity is actually absolutely crucial for the proper absorption of various essential nutrients from the food you eat, including magnesium. When you suppress this acidity for months or years on end, magnesium absorption dramatically collapses, leading to a deficiency that can have profound cardiac implications. But the concerns don't end there. There's another aspect that worries the medical community even more. Numerous large-scale observational studies have consistently found a troubling association between long-term PPI use and an increased risk of heart attack. One prominent theory attempting to explain this connection suggests that these drugs might reduce the levels of nitric oxide in the body. Nitric oxide is a critical molecule that helps keep your blood vessels flexible, relaxed, and healthy, allowing blood to flow smoothly. When its levels are depleted due to chronic PPI use, vessels can become stiffer and less elastic, effectively setting the stage for the formation of plaques and increasing the likelihood of a heart attack. While the precise causal relationship is still a subject of ongoing scientific debate and research, the repeated association is deeply concerning and cannot be ignored. Furthermore, omeprazole specifically can interfere with the effectiveness of other vital medications, such as clopidogrel, an antiplatelet drug frequently prescribed to patients after they've experienced a heart attack or stroke to prevent future clots. When taken concurrently, omeprazole can render this crucial protective medication less effective, leaving the patient dangerously vulnerable to another cardiovascular event. The fundamental problem with PPIs is that their use has become trivialized. These drugs were originally developed and intended for short-term treatments, typically lasting only 4 to 8 weeks, to address acute conditions. Yet, they have all too often transitioned into becoming permanent, lifelong solutions for problems that, in many cases, could be effectively managed or even resolved through significant lifestyle changes, such as dietary adjustments, weight loss, or avoiding trigger foods. If you have been taking a PPI for several months or even years, it is absolutely essential that you do not stop abruptly on your own, as this can lead to a rebound effect and worsening symptoms. Instead, make it a priority to have a detailed conversation with your doctor. Ask them directly, do I truly need to be on this medication long term? Can we explore options to reduce the dose gradually, or are there any alternative strategies or treatments we can consider? And if chronic use is absolutely deemed necessary by your physician, it is paramount that your magnesium levels are periodically monitored to prevent and address potential deficiencies before they become dangerous. A crucial interlude: empowering your health journey. Before we delve into the next medications on our list, which include some common remedies for simple colds that harbor hidden dangers, I want to make a quick and heartfelt request from you, the viewer. If the information you've heard so far has resonated with you, if it seems valuable and potentially life-saving, I am asking for 2 very simple yet incredibly impactful things. First, please take a moment to subscribe to this channel. My unwavering mission is to provide clear, direct, and straightforward health information, free from jargon and pharmaceutical influence, so that you are empowered to make the absolute best decisions for your own well-being and the health of your loved ones. By subscribing, you help me reach more people with these vital messages. Second, and perhaps even more important than subscribing, please share this video widely. Think about your parents, your grandparents, your siblings, your friends, and anyone you care about who might be taking these common medications. A single, simple click to share this content could be the catalyst for a crucial conversation that genuinely has the potential to save a life, preventing untold suffering and heartbreaking cardiac events. Thank you from the bottom of my heart for your invaluable support in this critical endeavor. The deceptive relief of cold medicines, oral decongestants. We now arrive at the 3rd medication type on our list, a category that almost everyone keeps readily available in their medicine cabinet at home. I'm talking about oral decongestants, those familiar pills and liquids designed to tackle the misery of colds and flu. Specifically, I'm referring to the ones containing active ingredients like pseudoephedrine or phenylephrine. They truly feel like a magic solution when that persistent stuffy nose just won't clear, offering quick and often dramatic relief from nasal congestion, allowing you to breathe freely again. However, that seemingly magical solution can carry an extremely high and potentially devastating cost for your heart, especially if you already have underlying high blood pressure, hypertension, or any pre-existing cardiovascular disease. Consider the case of Margaret, a spry 75-year-old retired teacher who, unfortunately, caught a particularly severe cold. Desperate to breathe easier and find relief from her blocked sinuses, she purchased a well-known over-the-counter cold remedy containing pseudoephedrine from her local pharmacy. By the 2nd day of taking the medication, she felt an alarming sensation, as if her heart was going to literally burst out of her chest. This terrifying palpitation was accompanied by terrible dizziness, a crushing pressure in her head, and a splitting headache that made her vision blur. Her worried son, recognizing the severity of her symptoms, immediately rushed her to the hospital. Upon arrival, her blood pressure was dangerously through the roof, registering at dangerously high levels, and she had developed a rapid, irregular heart rhythm known as an arrhythmia. That seemingly innocuous decongestant had pushed her delicate system to the very brink of a cardiac emergency. Why does this happen with drugs designed for a simple cold? Pseudoephedrine and phenylephrine are powerful vasoconstrictors. Their primary job is to constrict or narrow blood vessels. In your nose, This is precisely what you want, as it reduces the swelling of blood vessels in the nasal passages, alleviating congestion and allowing you to breathe more easily. However, the crucial point is that the drug doesn't act only in your nose. Once absorbed, it travels throughout your entire body, systematically constricting blood vessels everywhere. This widespread constriction has two critical and dangerous consequences for your heart. First, by narrowing arteries throughout your circulatory system, your heart is forced to pump blood against a much greater resistance. Imagine trying to push water through a garden hose that has suddenly been squeezed almost shut. The pressure inside that hose dramatically explodes. Similarly, your heart has to exert significantly more force to push blood through constricted vessels, which can trigger a sudden and dangerously high spike in blood pressure. Second, these decongestants are also potent stimulants. They directly affect your central nervous system, causing your heart to beat faster and often irregularly. If you already have a sensitive heart, perhaps due to age, pre-existing conditions, or even just a predisposition, this extra stimulation can completely destabilize its normal rhythm and function, leading to dangerous palpitations or even more severe arrhythmias. Recently, European medical agencies have refocused considerable attention on pseudoephedrine due to its concerning link with rare but serious syndromes involving severe constriction of blood vessels in the brain. This renewed focus only further underscores how potent and widespread its effects are throughout the entire body, extending far beyond simply clearing a stuffy nose. The major inherent danger with these drugs is their easy availability over the counter. People can purchase them without a prescription, often without carefully reading the fine print of the warning labels, and certainly without fully contemplating the profound risks they might be taking, especially for their heart health. Therefore, if you are over 60, and particularly if you suffer from hypertension or any known heart condition, it is paramount that you avoid these oral decongestants completely. There are far safer and equally effective alternatives available. Consider saline nasal sprays, which gently moisturize and clear nasal passages without systemic effects. Humidifiers can help moisten the air and alleviate congestion, or, if needed, nasal sprays containing corticosteroids, which act only locally in the nasal passages, can provide targeted relief without affecting your entire cardiovascular system. Do not allow the desire for simple relief for your nose to become a life-threatening emergency for your heart. The delicate balance, tricyclic antidepressants and the heart. We now arrive at the fourth medication class, addressing a delicate but undeniably vital topic: mental health. I am referring to an older class of antidepressants known as tricyclic antidepressants, or TCAs, with common names like amitriptyline or imipramine. While newer options are generally preferred today, these drugs are still sometimes prescribed for depression, and quite frequently, they are used to manage chronic neuropathic pain, such as nerve pain or certain types of headaches. It's important to acknowledge that depression itself is a significant risk factor for heart disease. The chronic stress and inflammation associated with untreated depression can negatively impact cardiovascular health. That's why treating depression is absolutely crucial. However, how we treat it matters enormously, as these particular drugs can pose substantial dangers to an older person's heart, impacting its function in several concerning ways. Let me share the experience of Frank, a 78-year-old gentleman who suffered from terrible, burning pain in his feet due to diabetes-related neuropathy. His doctor, aiming to alleviate his suffering, prescribed a low dose of amitriptyline. While the medication genuinely helped to lessen his pain, Frank soon began experiencing severe dizziness every single time he stood up from a sitting or lying position. One unfortunate day, this dizziness led him to faint suddenly, resulting in a fractured hip, a devastating injury for an older adult. The direct cause of his fall and injury was the amitriptyline, which had triggered a sudden and dangerous drop in blood pressure upon standing, a condition known as orthostatic hypotension. hypertension. But orthostatic hypotension is not the only risk associated with these drugs. Tricyclic antidepressants can also accelerate your resting heart rate, meaning your heart is working harder and faster even when you're at rest. This constant elevated workload places significant and unnecessary stress on an aging heart that may already be less resilient. What's most concerning, however, is their potential to interfere directly with the heart's intricate electrical conduction system, slowing down the vital electrical impulses that regulate its rhythm. This interference can be detected on electrocardiograms, ECGs, and significantly increases the risk of developing very dangerous ventricular arrhythmias, irregular heartbeats originating in the lower chambers of the heart, which can tragically lead to sudden cardiac death. For all these serious reasons, tricyclic antidepressants are generally no longer considered the first choice treatment for depression in older adults. Today, medical professionals prefer newer classes of antidepressants that have a much safer cardiovascular profile. However, as mentioned, TCAs are still quite commonly prescribed for conditions like neuropathic pain or migraine prevention. If you or a loved one are currently taking one of these medications, it is absolutely fundamental to have a thorough and frank discussion with your doctor. Key questions to ask include, have safer alternatives been thoroughly tried and explored for my condition? And is my blood pressure being regularly monitored, especially for sudden drops upon standing? And is my heart rhythm being periodically checked? Mental and physical health are inextricably linked. They go hand in hand. You need to ensure that the treatment intended to improve one aspect of your health isn't inadvertently damaging another, particularly your vital heart. The controversial pill, calcium supplements. And now, we arrive at the final medication on our list, number 1. This is perhaps the most controversial and widely debated point among medical professionals and the public alike, but as your cardiac surgeon, it is my absolute duty to share the significant concern that currently exists within the scientific community regarding this common supplement. I am talking about calcium supplements. Yes, you heard me correctly. Those very pills that millions of people conscientiously take every single day with the intention of protecting their bones from osteoporosis, a condition that weakens bones and makes them brittle. For decades, the medical message regarding calcium was crystal clear and universally accepted. Take calcium, often in high doses, to ensure strong bones and prevent fractures. But in recent years, a growing body of research, more and more studies, are increasingly questioning the safety of these supplements specifically for the heart. The traditional wisdom is being challenged by emerging evidence. Let me introduce you to Linda, a 70-year-old woman. Worried about her bone density and the risk of osteoporosis, she took it upon herself to start taking a high-dose calcium supplement daily, believing she was doing something proactively beneficial for her health. Years later, she unexpectedly suffered a heart attack. What made her case particularly perplexing to her medical team was that she didn't present with the classic, well-established risk factors for heart disease. She wasn't a smoker, her cholesterol levels were well within healthy ranges, and her blood pressure was consistently normal. As her medical team meticulously investigated possible causes for her heart attack, their attention increasingly focused on that daily calcium supplement she had been taking for so long. The controversy surrounding calcium supplements and heart health is very real, and it is complex. The scientific evidence isn't yet definitive or universally conclusive, with some studies showing a link and others not. However, the hypothesis that deeply concerns us and deserves your attention goes like this. Calcium obtained naturally from food sources such as dairy products, milk, yogurt, cheese, or leafy green vegetables doesn't appear to be problematic. It's absorbed slowly and steadily by the body, which can then use it efficiently for bone formation and other bodily functions without overwhelming the system. The potential problem, however, appears to arise with the high, concentrated doses delivered rapidly from supplements, particularly those taken as a single pill. When you ingest a calcium supplement in pill form, it can create an artificial and rapid spike of calcium in your bloodstream, a level far higher than what your body would naturally experience from dietary intake. Your body, despite its best efforts, may not be able to utilize all of that sudden influx of calcium effectively for your bones, and the excess has to go somewhere. The primary concern among researchers is that this excess calcium can end up depositing in the walls of your arteries. This process, known as arterial calcification, leads to the hardening and stiffening of your arteries. Rigid arteries are less able to expand and contract, which increases the workload on your heart and can directly contribute to the formation and progression of the fatty plaques that are the underlying cause of most heart attacks and strokes. Some large-scale studies have indeed suggested that calcium supplements modestly increase the risk of heart attack, while other rigorous studies have not found this specific connection. The evidence is complex and still evolving. For certain individuals with a confirmed diagnosis of severe osteoporosis, where the risk of fracture is very high, the carefully weighed benefits of a calcium supplement might still outweigh these potential cardiovascular risks. However, the overarching lesson here is unequivocally clear. When it comes to calcium, more is not necessarily better, and in some cases, it could be detrimental. The safest and most advisable strategy for maintaining healthy calcium levels is to obtain it primarily from your regular diet. If your doctor genuinely believes you have a specific need for a calcium supplement, never, under any circumstances, start taking it on your own without their direct guidance. It is a significant medical decision that must involve a careful and personalized assessment, weighing your bone health status against, and very importantly, your individual cardiovascular risk profile. Empowerment through knowledge, protecting your heart today and tomorrow. Today, we have meticulously uncovered the often hidden side effects and potential dangers of 5 very common types of medications: anti-inflammatories, NSAIDs, gastric protectors, PPIs, oral decongestants for colds, certain older antidepressants, TCAs, and surprisingly, calcium supplements. My primary message to you is not one of panic or alarm, and crucially, it is not to abruptly stop taking any of your prescribed medications on your own. Doing so without medical supervision could be extremely dangerous, potentially causing immediate harm or exacerbating existing conditions. My message, instead, is one of empowerment. You now possess valuable, critical information that, astonishingly, most people are completely unaware of. You understand that the pill you take for arthritis pain, while providing relief, could be silently overloading your heart. You now know that your daily stomach protector, intended to ease digestive discomfort, might actually be subtly affecting your heart's delicate rhythm. You are aware that a seemingly simple cold remedy, easily bought over the counter, could pose a serious risk to your cardiovascular system. Use this newfound knowledge wisely to become an active, engaged, and informed partner in your own health journey. The next time you visit your doctor, don't go in passively. Go prepared. Take a comprehensive list of absolutely everything you are currently taking, and that includes all over-the-counter medications, herbal remedies, supplements, and vitamins. Then, armed with this information, ask clear, pointed questions. Be direct and assertive. Doctor, I've learned that this particular medication could potentially carry certain risks for my heart. Given my current health status and medical history, is it genuinely still the best and safest option for me? Are there any equally effective but potentially safer alternatives that we could consider? And should we be proactively monitoring something specific, like my blood pressure or heart rhythm, or perhaps running some specific diagnostic tests to ensure my heart remains healthy? Every medical treatment, every pill, involves a delicate balance between its potential benefits and its inherent risks. And that balance is not static. It dynamically changes with age. Your heart has diligently worked hard for decades, pumping billions of times throughout your life. It deserves exquisite, informed care and protection now more than ever. Taking proactive steps to protect your heart armed with knowledge, is undoubtedly the single best investment you can make in your long-term health and your future well-being. Never take any medication for granted, no matter how common or seemingly harmless it appears to be. And now, I'm asking for one final, simple thing from you. Please share your own experiences and thoughts in the comments section below this video. Did something here surprise you? Did you recognize a medication you're currently taking? Your personal stories and insights can be incredibly powerful, helping to raise awareness and provide valuable support to countless others who might be facing similar concerns. And always remember the most crucial takeaway. Always talk to your doctor. That informed conversation, that open dialogue, is the single most important step you can take today to protect your heart for a healthier tomorrow. Please take good care of yourself.